Hello and welcome. My name's Hogan Quinn, and today I'm going to be presenting my assignment on the discussion and the application of a TENS machine and how it relates to the concepts of contemporary pain science. Throughout this assignment, I'm going to be referring to the example of Gertrude, the 34-year-old woman who's in her third trimester of her pregnancy, who is aiming to utilise a TENS machine to assist with pain relief while she goes through labour. Right, so just for starters, this is the definition of a TENS machine. So TENS literally just stands for the transcutaneous electrical nerve stimulation, which essentially means that it's, as mentioned, stimulates the nerves via the use of electrical pulses underneath the skin. So that'll obviously go through the skin into the tissues and the nerves and all that sort of stuff around there. A TENS machine is it's a modern machine that adheres to the contemporary pain science principles. So in modern times, it's become known that the pain that we experience on a day-to-day basis is more so a protection of the integrity of the tissue and has less of a role of actually monitoring the tissue damage status. Essentially what this means is that instead of the pain being a monitor for tissue damage status and just sending nervous impulses to the brain and back down once the tissue is fully failed and just broken, it's protecting the integrity of the tissue, almost as if it's like sending a warning signal, which means that if the tissue is to continue to be placed under this stress, then it will reach a failure point later down the line. So yeah, essentially the final point to be made is that hurt does not always equal harm. So just a quick example of this is if you hit your arm, it may hurt for a little bit, but unless you continue to do the same thing, it's unlikely to cause long-term harm to the tissues underneath. Moving forward, we're just going to be having a look at a few of the benefits that patients going through labour will experience by using a TENS machine. In particular, our example, Gertrude. The first of these, probably the most obvious of them all, is the pain relief that the patients will experience. So obviously, during labour, that's probably its main role is to limit the amount of pain experienced throughout contractions and all that stuff. So yeah, it will contribute to patients experiencing a much more calm labour as they have the ability to control or at least somewhat limit the amount of pain they're experiencing. And as we know, pain is probably just not a great experience to go through, so to be able to limit that as much as possible is ideal. Following on, it doesn't require any medications to take, as it's just a few pads stuck on the body here and there, and electrical pulses controlled by the user. So this leaves that there's no chance for any sort of chemical reactions or anything like that. There is a chance for some allergic reactions with the pads, but we'll speak about that later on. Continuing on to another benefit of the TENS machines, we have movement. So patients such as Gertrude, they'll often feel a lot more relaxed and a lot more comfortable if they are able to move around relatively freely. And in addition to this, it also creates a little bit of a placebo effect as they'll feel more confident that their labour will be successful as they'll be experiencing less pain by using the TENS machine. Moving on again, it can be used at home as well. So this is often used as soon as labour begins, so before patients are able to make it to the hospital. And because of this, it's relatively easy to use, which means it's also easy to control the pain and limit that where possible. Finally, another one of the very big benefits of the TENS machine is that it has no harm to the mother or the baby. This is obviously quite important, as harm is something that no one wishes for, especially with a newborn child. And yeah, so overall, there's just very little disadvantages to come from the TENS machine. So moving swiftly on, we're just going to be having a look at how the TENS actually works, in particular with labour patients. So the first point here that I've written is that the overall reasoning for how TENS work is relatively unknown, although in saying that there are a few theories that can help everyone understand it. The first of these is that the electrical pulses block the nervous signals from reaching the brain and therefore will limit the pain. Instead of the tissues sending the pain signal up through the brain and then coming back down, the electrical impulses will actually stop that. So I'll just draw a quick diagram as I've got just here. So when the TENS machine isn't being implemented, the pain signals, especially during labour, will reach the brain and come back down via the spinal cord. When the TENS machine is being operated, however, and the electrical impulses have an ability to limit that, the pain signals, the nervous signals, don't have the chance to reach the brain, and they'll stop before they reach the spinal cord, meaning that they have no chance to reach the brain and come back and create what is pain. Another point to be mentioned is that the pulses of the electrical of the TENS machine will stimulate the release of endorphins. So endorphins are essentially just hormones that are released to make people happy and make them feel more comfortable, more relaxed, all that sort of stuff that is very crucial to a successful labour, and it's part of the reason why we had so many of the benefits previously mentioned. In addition to this, the TENS machine can often distract the mother from the contractions that she's experiencing. It does this because it gives her another point of focus. So she's focusing on something else. She can. It again places a bit of a placebo impact in her mind as she can feel more confident in the labour going successfully. Finally, can also be mentally relaxing for the patient as they're able to feel a lot more in control of their labour. Having the buttons at the touch of your finger can provide a lot of stability and a lot of confidence in a lot of patients, as they have the ability to, like I said, control when they're able to use the electrical impulses. In doing this, if they are experiencing any type of pain, they do again have the ability to limit that just wherever possible. Finally, we're just going to be having a look at a few of the situations where you would not use a TENS machine. The first of these is quite possibly the most important, is prior to 36 weeks pregnant. So with the example of Gertrude, it is understood that she is in her 3rd trimester of pregnancy, which means that she is after this time period, meaning that it is safe for her to use a TENS machine. The reasoning behind this is that it is completely unknown whether the TENS machine will have an impact on the fetal development of the child. Moving on to the next scenario, as we have just in the bath or shower. Relatively explanatory for this one. Obviously, water and electricity don't mix together too well, so if you're using a TENS machine in the bath or a shower, you're at risk of causing extra harm to yourself and your child. The next situation would be if the individual has a pacemaker or any other form of electronic device. If this is the case, then it could create an electromagnetic interference, which essentially means that with the two electronic devices being used at the same time, they have potential to both fail and not work to the best of their capabilities. And finally, if the patient has an allergic reaction to the electrode pads that are to be placed on the body, obviously having an allergic reaction, especially during labour, is something that's not ideal for anyone. And the final point I've just written down here is that labour can and often will still be successful without the use of TENS. So if any of these are to be a barrier, it's still okay. It's completely fine to complete labour without the use of a TENS machine. Thanks very much for listening to my presentation on the use of a TENS machine, especially during labour. I hope that you have now a greater understanding of what they do and how they can benefit labour patients.